The war on drugs has failed. This is not just a recent observation but a conclusion drawn from decades of evidence and countless studies. This is not an opinion, it is a fact. The data is overwhelming and paints a grim picture of a policy that has not only failed to achieve its goals but has also caused significant harm. For decades we have waged a costly and destructive battle against drugs, and the results are undeniable. Despite the immense resources allocated to this war, the availability and potency of drugs have only increased. Mass incarceration has become the norm, disproportionately impacting marginalized communities. The prison population has exploded, with non-violent drug offenders making up a significant portion of inmates. Violence associated with the black market continues to plague our streets. The illegal drug trade fuels gang violence and crime, creating unsafe environments for everyone. We have poured billions of dollars into law enforcement, prisons, and interdiction efforts, yet drugs are more available and potent than ever before. The financial burden on taxpayers is enormous, with little to show for it. The human cost of this failed war is immeasurable. Families are left to mourn the loss of loved ones who have fallen victim to addiction and overdose. Millions of lives have been shattered by addiction, overdose, and imprisonment. The cycle of addiction and incarceration traps individuals in a never-ending loop of despair. Families have been torn apart, and communities ravaged by violence. The social fabric of many neighborhoods has been irreparably damaged. The criminalization of drug use has created a stigma that prevents people from seeking help and perpetuates a cycle of shame and despair. This stigma extends beyond the individual, affecting families and entire communities. The war on drugs was supposed to protect us, but it has done the opposite. Instead of reducing drug use and its associated harms, it has exacerbated them. It has fueled violence, exacerbated social inequalities, and undermined public health. The resources spent on this war could have been better used to address the root causes of drug addiction and provide support for those in need. The time has come to acknowledge this failure and chart a new course. We must listen to the voices of those who have been most affected and learn from the experiences of other countries that have taken a different approach. We need a radical shift in our approach, one that prioritizes compassion, evidence-based solutions, and the health and well-being of all citizens. This means investing in prevention, treatment, and harm reduction strategies. The first step in this journey is to decriminalize all drugs. Decriminalization would remove the criminal penalties for drug use and possession, allowing individuals to seek help without fear of legal repercussions. It would also free up resources to be redirected towards more effective and humane solutions. Countries like Portugal have shown that decriminalization, combined with robust public health initiatives, can lead to significant reductions in drug-related harm. By treating drug use as a public health issue rather than a criminal one, we can create a more just and compassionate society. It's time to end the war on drugs and embrace a new approach that prioritizes human dignity, health, and well-being. Together, we can build a future where drug policies are grounded in science, compassion, and respect for human rights. In the year 2000, Portugal stood at a crossroads. The nation was facing a crisis that seemed insurmountable, a crisis that was tearing at the very fabric of its society. Like many countries around the world, it was grappling with the devastating consequences of drug prohibition. The streets were filled with despair, and communities were crumbling under the weight of addiction and criminalization. Drug-related deaths were on the rise. HIV infection rates among people who use drugs were among the highest in Europe, and the country's prisons were overflowing with non-violent drug offenders. Families were being torn apart, and the healthcare system was overwhelmed. Something had to change. In a bold and controversial move, Portugal decided to decriminalize the possession and use of all drugs. This decision was not made lightly. It was a calculated risk, a leap of faith into uncharted territory. This didn't mean that drugs were legal. Rather, it meant that possession of small amounts for personal use was no longer a criminal offense, but an administrative one, similar to a parking ticket. The focus shifted from punishment to support. Instead of being arrested and incarcerated, people caught with drugs were referred to a dissuasion commission composed of health and social work professionals. These commissions were designed to help, not to punish. These commissions provided information about treatment options, harm reduction services, and social support. They offered a lifeline to those struggling with addiction, a chance to reclaim their lives and reintegrate into society. The results of Portugal's experiment have been nothing short of remarkable. The country has witnessed a transformation that few could have predicted. Contrary to the dire predictions of some, drug use did not skyrocket. In fact, the opposite happened. Communities began to heal and the streets became safer. In fact, Portugal has seen a significant decrease in drug-related deaths, HIV infections, and overall drug use, especially among young people. The healthcare system, once burdened by the crisis, now had the capacity to provide better care and support. This remarkable turnaround has made Portugal a shining example of the potential benefits of drug decriminalization. The country's journey from despair to hope serves as an inspiration to the world, a testament to the power of progressive policy and compassionate care. Portugal's story is a beacon of hope in the drug war darkness, illuminating a path forward for other nations grappling with similar challenges. One of the most immediate and impactful consequences of drug decriminalization is the dismantling of the black market. When drugs are criminalized, their production, distribution, and sale are driven underground, creating a lucrative illicit market controlled by criminal organizations. This black market thrives on violence, corruption, and exploitation, fueling a cycle of crime and instability that spills over into the wider community. Decriminalization strikes at the heart of this illicit trade by removing the criminal element from the equation. When possession and use are no longer criminal offenses, a significant portion of the demand for drugs shifts from the black market to regulated and controlled sources. This undermines the financial foundation of criminal organizations, weakening their grip on communities and reducing the violence associated with drug trafficking. The experience of Portugal provides compelling evidence of this phenomenon. Following decriminalization, drug-related crime plummeted and the black market for drugs shrank significantly. This allowed law enforcement to focus its resources on more serious crimes and freed up valuable resources that could be redirected towards healthcare, education, and social services. The war on drugs has been characterized by a punitive approach that emphasizes criminal justice responses over public health solutions. This approach has been in place for decades, with the primary focus being on arresting and incarcerating individuals who use or possess drugs. The idea was to deter drug use through the fear of punishment, but this strategy has not yielded the desired results. This approach has been ineffective and counterproductive, leading to mass incarceration, racial disparities in the criminal justice system, and a culture of fear and stigma surrounding drug use. The prisons are overcrowded, filled with nonviolent drug offenders who often come from marginalized communities. The racial disparities are stark, with people of color being disproportionately affected by these harsh drug laws. This has created a cycle of poverty and criminalization that is difficult to break. Decriminalization represents a fundamental shift away from this punitive paradigm towards a harm reduction approach that prioritizes the health and well-being of people who use drugs. This shift is not just about changing laws, but also about changing attitudes and perceptions. It involves recognizing that drug use is a public health issue rather than a criminal one. By decriminalizing drug use, we can reduce the stigma and fear that prevent people from seeking help. Harm reduction recognizes that drug use is a complex issue with a wide range of social, economic, and psychological factors at play. People use drugs for various reasons, including coping with trauma, mental health issues, and socioeconomic challenges. A one-size-fits-all punitive approach does not address these underlying issues. Instead, harm reduction seeks to meet people where they are, providing support and resources tailored to their specific needs. It seeks to minimize the negative consequences of drug use without necessarily requiring abstinence, acknowledging that people use drugs for a variety of reasons, and that forcing abstinence is often unrealistic and counterproductive. Harm reduction strategies include providing clean needles to prevent the spread of infectious diseases, offering safe spaces for drug consumption, and distributing naloxone to prevent overdoses. These interventions save lives and improve the overall health of communities. Harm reduction strategies encompass a wide range of interventions, including needle exchange programs to reduce the spread of HIV and hepatitis C, overdose prevention programs that provide access to naloxone, a medication that can reverse opioid overdoses, supervised consumption sites that offer a safe and hygienic environment for people to use drugs under medical supervision, and drug checking services that allow people to test their drugs for purity and potency, reducing the risk of overdose from unexpectedly strong substances. These programs are often run by community organizations and public health agencies working together to create a safer environment for everyone. By shifting the focus from punishment to harm reduction, we can create a more compassionate and effective response to drug use, one that prioritizes the health and dignity of all citizens. This approach not only benefits individuals who use drugs but also their families and communities. It reduces the burden on the criminal justice system and allows resources to be redirected towards prevention, treatment, and support services. Ultimately, harm reduction is about recognizing the humanity in everyone and working towards a society where everyone has the opportunity to live a healthy and fulfilling life.